Have you ever stood at a funeral and wondered, how did this happen? He was fine last month. She was just at the family dinner 2 weeks ago, laughing, making plans for the holidays. And now everyone is standing here in black, completely in shock, asking the same question over and over again. How did nobody see this coming? I want to tell you something that most doctors do not say loudly enough. In the majority of those cases, there was a warning. There was always a warning. It was right there, hiding in plain sight, inside a simple number that nobody took seriously. That number was blood pressure. And today, I am going to show you exactly how that silent number becomes a death sentence, and more importantly, what you can do right now to make sure it never becomes yours. My name is William Hart, and I have spent years sitting across from patients in my office, reviewing test results, delivering news that changes families forever. And I can tell you with complete certainty that the most dangerous patient I ever treat is not the one who is sick and knows it. The most dangerous patient is the one who is sick and feels absolutely fine. Because that person is not scared. That person is not motivated to change. That person goes home, eats the same food, skips the same medications, ignores the same numbers, and one ordinary Tuesday morning, everything changes in an instant. I do not want that to be you. I do not want that to be someone you love. So please, stay with me through this entire video, because what I am about to share could be the most important thing you watch this year. Let us start with the most fundamental question. What is high blood pressure actually doing inside your body right now, while you sit here feeling completely normal? Imagine your blood vessels as a network of pipes running through your entire body. Your heart is the pump. Every time your heart beats, it pushes blood through those pipes, delivering oxygen and nutrients to every single organ, every single tissue, every single cell in your body. Now, when the pressure of that blood pushing against the walls of those pipes becomes too high, those walls start to take damage. Not damage you can feel. Not damage that shows up on your face or slows you down at the gym. Microscopic damage. The kind that builds up over months and years without any symptoms at all. And here is the critical thing to understand. Your body tries to adapt to this damage. Your artery walls respond by becoming thicker and stiffer. And that thickening and stiffening makes it even harder for your heart to push blood through them. So your heart works even harder. And the pressure gets even worse. It is a vicious cycle that slowly, quietly, relentlessly escalates until something breaks. Now I want to explain to you exactly how this process leads to a heart attack. Because most people have a vague idea that high blood pressure is bad for the heart, but they do not understand the specific mechanism. And when you understand it, you will never look at a blood pressure reading the same way again. When your artery walls are repeatedly damaged by high pressure, your immune system sends cells to the damaged areas to try to repair them. Over time, cholesterol and fats in your blood get caught up in this repair process and start to accumulate inside the artery walls. This buildup is called plaque. And plaque is not just a passive lump sitting inside your artery. It is an active, unstable structure. It grows over the years, gradually narrowing the space inside your arteries, reducing blood flow to your heart. But the real danger is not even the gradual narrowing. The real danger is what happens when a piece of that plaque suddenly ruptures, breaks open, like a blister that finally pops. When that happens, your body immediately tries to form a clot to seal the rupture. And if that clot is large enough to completely block the artery, blood flow to your heart muscle stops. Completely. And the heart muscle that was depending on that blood flow begins to die. That is a heart attack. That is the moment people describe as the worst pain of their life. That is the phone call nobody wants to make at 2 in the morning. And high blood pressure is the force that damaged the artery walls in the first place, started the plaque building, and created the conditions for that rupture to happen. Now let us talk about stroke, because I think people underestimate how truly devastating a stroke is compared to almost any other medical event. When high blood pressure damages the blood vessels leading to your brain, it creates 2 different types of danger. The first is the same plaque and clot process I just described, A clot blocks a blood vessel in the brain, cutting off oxygen to brain tissue. This is called an ischemic stroke, and it accounts for the majority of strokes. The second type is even more dramatic. When blood pressure has been severely high for a long time, it can actually cause a blood vessel in the brain to burst, bleeding directly into brain tissue. This is called a hemorrhagic stroke, and it is often fatal. Now here is what I need you to truly absorb about strokes. Brain cells begin dying within 4 minutes of losing blood supply. Not hours. For minutes. And the brain controls everything. Your ability to speak. Your ability to understand language. Your ability to move your right arm, your left leg. Your ability to recognize your own children's faces. Depending on which part of the brain is affected, a stroke survivor can wake up completely unable to communicate, paralyzed on one side, or trapped in a mental fog they may never fully emerge from. I have had patients who were vibrant, independent, sharp-minded people, and after one stroke, they could no longer button their own shirt. The number one controllable risk factor for stroke, the one thing you can actually do something about, is high blood pressure. I also need to talk to you about something called hypertensive heart disease, because this is where the long-term consequences of high blood pressure become truly irreversible if left unchecked. When your heart is forced to pump against high pressure day after day, year after year, the main pumping chamber, the left ventricle, begins to thicken. Your heart is a muscle, and like any muscle under constant heavy load, it grows bigger in response to the demand. But unlike a bicep that gets stronger when it grows, a thickened heart muscle actually becomes less flexible, less efficient, and more prone to dangerous electrical problems. This condition is called left ventricular hypertrophy, and it significantly increases your risk of heart failure, a condition where your heart simply cannot pump enough blood to meet your body's needs. Heart failure does not mean your heart stops. It means your heart is failing to do its job properly. Fluid backs up into your lungs. You become exhausted climbing a single flight of stairs. You wake up in the night unable to breathe. Your ankles and legs swell with fluid your heart cannot circulate properly. It is a progressive, debilitating condition, and high blood pressure is one of its leading causes. Now here is something I want to address directly, because I hear this from patients constantly. They say, "Hart, I have had high blood pressure for years and nothing bad has happened to me. I feel completely fine." And I understand why that feels reassuring. But let me reframe it for you. If you smoke a cigarette every day for 20 years and you have not gotten lung cancer yet, that does not mean the cigarettes are not damaging your lungs every single day. High blood pressure works on the exact same principle. The damage is cumulative. It compounds over time. And the fact that the catastrophic event has not happened yet does not mean the conditions for it are not being built right now, quietly, inside your arteries and your heart and your brain. The absence of a crisis is not the same as the absence of damage. There is also a critical window that most people miss, and missing it is one of the most costly mistakes a person can make with their health. High blood pressure is far easier to manage and far less damaging when it is caught early, in the stage doctors call elevated or stage 1 hypertension, than when it has been allowed to progress uncontrolled for years. In the early stages, lifestyle changes alone can often bring blood pressure back to normal. Better diet, reduced sodium, regular physical activity, improved sleep, stress management, these things genuinely work when blood pressure is caught early. But once the arteries have stiffened, once the plaque has built up, once the heart has begun to remodel itself in response to years of overwork, you cannot undo that damage with diet and exercise alone. You are now managing a disease that has already left permanent marks on your cardiovascular system. The window for the easiest intervention closes slowly, but it does close. And every month of uncontrolled high blood pressure moves you further away from that window. Let me give you some numbers that I want you to remember. A person with consistently high blood pressure, readings above 140/90, is 3 times more likely to develop heart disease, 4 times more likely to have a heart attack, and 7 times more likely to have a stroke compared to someone with normal blood pressure. 7 times. And approximately half of all adults in the United States have blood pressure that is either elevated or in the high range. That means right now, as you watch this video, roughly 1 in 2 people around you are carrying this risk, and a significant portion of them have no idea. They have not checked. They have not felt any different. They are simply living their normal lives while the clock quietly ticks. So here is what I am asking you to do, not someday, not after you finish this video and go about your day, right now, today. Number 1, find out your number. If you have a blood pressure monitor at home, check it today. If you do not have one, they are inexpensive and available everywhere, and knowing your number is one of the most important pieces of health information you can have. If you are consistently seeing readings above 130/80, talk to your doctor. If you are seeing readings above 140/90 regularly, that conversation needs to happen this week, not eventually. Number 2, if you are already on blood pressure medication, please do not stop taking it because you feel fine. This is one of the most common and most dangerous mistakes I see. The medication is likely why you feel fine. Stopping it because you feel good is like turning off your smoke alarm because there is no fire right now. It removes the protection exactly when you might need it most. Number 3, take the lifestyle factors seriously, not as suggestions, but as medicine. Sodium reduction, consistent physical activity, quality sleep, stress management, maintaining a healthy weight, each of these directly and measurably impacts your blood pressure numbers. They are not optional extras. They are foundational. And finally, I want to leave you with this thought. High blood pressure does not send you a calendar invite. It does not give you a countdown. It simply works in the background of your life, every single day, making quiet arrangements that you are not aware of, until suddenly you are in an ambulance, or someone you love is, and everything that seemed important an hour ago no longer matters at all. The patients I worry most about are not the ones sitting in my office scared and motivated to make changes. The patients I worry about are the ones who watched a video like this, nodded along, felt briefly concerned, and then went back to their day without doing anything differently. Please do not be that person. You have information right now that many people never had before their lives changed forever. Use it. Check your numbers. Talk to your doctor. Take this seriously today, because your future self, and everyone who loves you, is depending on the decision you make in the next 24 hours. If this video opened your eyes to something important, do me one small favor. Hit that like button and subscribe to this channel because every week I am here with the honest, straightforward medical information that could protect your life and the lives of the people you love most.